Welcome to Active Healthcare, a place to share medical knowledge and comprehensive healthcare tips so you can live a healthy and happy life every day. Let's continue with our series on kidney stones. In the previous video, we shared with you 6 advanced methods for treating kidney stones. You can re-watch that video on the Active Healthcare channel. In this video, we will answer the question, can kidney stones really disappear on their own? To answer this question, let's briefly review the process of kidney stone formation. Kidney stones usually originate in the kidneys and form in one or both of them. However, stones can grow and move to other parts of the urinary tract, such as the ureters, bladder, and urethra. Based on their composition, kidney stones can be divided into 4 types, and their formation occurs as follows. 1. Calcium oxalate stones. This is the most common type of kidney stone. These solid masses form in the kidneys when your body has an excess of calcium and oxalate. Oxalate is a naturally occurring substance found in many foods. Your body uses food to provide energy, and after your body takes what it needs, waste products pass through the blood to the kidneys and are eliminated through urine. Urine contains various waste substances, and if there is too much waste and too little fluid, crystals can begin to form. These crystals can stick together and form a solid mass, kidney stone. Oxalate is a type of substance that can form crystals in urine, which can happen when there is too much oxalate, too little fluid, and oxalate binds with calcium to create stones in the kidneys. 2. Uric acid stones. Uric acid kidney stones form when urine becomes oversaturated with uric acid, leading to the formation of urate stones. Uric acid stones are often found in patients with elevated uric acid levels, gout, a disorder of nucleic acid metabolism, genetic predisposition, obesity, or insulin-resistant diabetes. While uric acid kidney stones are not as hard as calcium stones, they are more difficult to detect. 3. Struvite stones. Struvite stones, also known as infection stones, are formed due to long-standing urinary tract infections caused by bacteria that can break down urea into ammonium. When ammonium combines with magnesium and phosphate in the urine, it forms stones. The bacteria that cause the stones often adhere to the stone itself. As more ammonium attaches, the stone gradually grows. It continues to grow and wraps around the core of the stone until the entire renal pelvis is filled with stones. At this point, it is called a staghorn calculus, because on X-rays it resembles the antlers of a deer. 4. Cystine stones. Cystine stones occur due to elevated cystine levels in the urine and are typically yellow-brown in color. Among urinary stones, this is the rarest type, accounting for only 1 to 2% of cases. The primary cause of cystine stone formation is a homozygous mutation in the SLC3A1 or SLC7A9 genes. These mutations impair the body's ability to reabsorb cystine, forcing it to be excreted in the urine, which increases cystine levels. Cystine has poor solubility in acidic urine, and when its concentration exceeds the urine's ability to dissolve it, cystine crystals precipitate and form stones. Now let's answer the question, can kidney stones really disappear on their own? The answer is yes, but not all kidney stones can pass naturally. Whether a kidney stone can be expelled depends on many factors such as the size of the stone, its location, and the individual's body. For small kidney stones, typically less than 4 millimeters, they can often pass out through the urinary tract easily without medical intervention. In these cases, it's important to drink enough water daily and stay physically active. Sometimes simply running or jumping can help the stone move from the kidney through the ureter into the bladder, where it can be expelled through the urethra. For larger stones, between 4 to 6 millimeters in size, you may need help from diuretic medications. There is about a 50% chance that stones of this size can be passed naturally, depending on the stone's shape and the urinary tract's condition. It's essential to consult your doctor and follow their recommendations for the best treatment plan. As for the location of the stone, stones in the lower third of the ureter are more likely to pass on their own compared to stones in the kidney or the upper third of the ureter. Your overall health also plays a role. People with a clear and uninfected urinary tract are more likely to expel stones on their own than those with a narrowed or inflamed urinary tract. Therefore, if you are diagnosed with kidney stones, the first step is to change your lifestyle to prevent the stone from growing larger. If you have calcium oxalate stones, in addition to reducing salt intake and drinking enough water, you should also limit your oxalate absorption by avoiding or reducing foods rich in oxalate, such as beans, coffee, spinach, etc. Similarly, for uric acid stones, limit red meat consumption to reduce uric acid levels in the blood, thereby reducing the risk of uric acid stones growing larger. For struvite stones, which are caused by urinary tract infections, you need to consult your doctor and take antibiotics as prescribed to treat the infection. Struvite stones are caused by bacteria, so it's important to remove the stone completely. Even a small remaining piece can easily lead to the stone reforming. For cystine stones, it is essential to drink plenty of water, alkalize the urine, and limit salt or sodium intake. When do you need medical intervention? For kidney stones that are large, ranging from 6 to 10 millimeters, you may need surgical intervention to treat them. Extracorporeal shock wave, lithotripsy, ESWL, may be the optimal treatment choice in these cases. Complications caused by stones. Immediate medical intervention is necessary in cases of severe pain, blood in the urine, or urinary obstruction leading to hydronephrosis, urine backing up into the kidneys, or infection. Stones that have been present for too long. If the stone is located in the kidney and is of moderate size, not affecting kidney or urinary function, immediate intervention may not be necessary. However, if the stone has blocked the urinary tract for an extended period, causing narrowing or hydronephrosis, it can lead to more serious complications such as renal pelvis dilation, kidney failure, infection, or loss of kidney function. Recommendations for stones to pass. Naturally, drink plenty of water. This is the most common advice urologists give to their patients. Drinking at least 1.5 to 2 liters of water per day, adjusted based on body weight, helps flush out stone debris and prevents the stones from growing larger. It also makes it easier for the body to expel stones naturally. Regular physical activity, walking, running, jumping, or participating in sports activities can help stones move closer to the bladder, making them easier to pass. Combining proper hydration with activities like jumping rope is one of the best methods for patients with small stones. Take medication as prescribed by your doctor. In some cases, the doctor may prescribe medication to relax the smooth muscles in the ureter, which can make it easier for the stones to be passed out of the body. In summary, kidney stones can pass on their own in certain cases, especially when they are small and located in favorable positions. However, if the stones are large or cause serious complications, timely medical intervention is required to avoid health risks. Always monitor your symptoms closely and consult your doctor to find the most suitable treatment plan. This video has answered the question, can kidney stones go away on their own? If you found it helpful, please share it with your friends and family. Don't forget to subscribe and hit the notification bell to stay updated with our latest videos on kidney stones.